Assalamu alaikum. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bashundhara Ad-din Medical College. Dear students, welcome to you all today's online pathology session. Today I am going to discuss about a new topic, that is female genital tract. At first, there are many organisms that are responsible for the genital infection, and they are trichomoniasis that causes vaginal itching, then candidal infection, Gardnerella infection, mycoplasma infection that is responsible for spontaneous abortion, chlamydial infection that causes infertility, gonorrhea that also causes infertility, and lastly human papillomavirus that causes carcinoma of cervix. And also there are sexually transmitted disease that occurs in female genital tract, and there are also bacterial and parasitic causes which include trichomoniasis, gonorrhea, syphilis, chancroid, granuloma inguinale, lymphogranuloma venereum, mycoplasma infection and chlamydial infection. And the viral causes included herpes virus infection, human papillomavirus infection, HIV infection and hepatitis B virus infection. Now come to our next topics, that is pelvic inflammatory disease, and this is a common disorder that starts from lower to upper genital tract infection, and it is characterized by pelvic pain, adnexal tenderness, fever and vaginal discharge, and it is caused by one or more of the following organism, that is gonococcal infection, chlamydial infection, coliform bacilli or enterobacteriosis infection and other polymicrobial infection. And there are also another term, that is postpartum pelvic inflammatory disease, and it is occur due to mishandling during delivery or abortion when the sterility is not maintained, and here the infection is polymicrobial and which is caused by Streptococcus, Staphylococcus and Clostridium perfringens. Then the pathogenesis of pelvic inflammatory disease are categorized into two categories. If it is occurred by gonococcal infection, the inflammatory changes start to appear approximately 2 to 7 days after inoculation. At first it involves the Bartholin glands, other vestibular glands, periurethral glands, and then it spreads through the vagina and then pass through the endocervical glands to endometrium without endometritis, then to the fallopian tube, and which causes salpingitis, and when the infection goes to ovary, that causes euphoritis, and ultimately the patient develops salpingo-euphoritis. And in case of other non-gonococcal infection, it passes through the lymphatics or hematogenous route and directly reach the fallopian tube and ovary and causes salpingo-euphoritis. And the complication of pelvic inflammatory diseases are peritonitis, intestinal obstruction which occur due to adhesion between the small bowel and pelvic organ, then bacteremia which may produce endocarditis, meningitis and suppurative arthritis, and it also causes infertility. This is the picture showing the cervix. We know the cervix has two parts, one is exocervix and another one is endocervix, and the exocervix is lined by squamous epithelium, the endocervix is lined by columnar epithelium, and there are also a transformational zone, the junction between the exocervix and endocervix. The metaplasia and dysplasia start from this zone. Now come to the next topic, that is the disease of the cervix. The disease of the cervix categorized into 3 categories. One is congenital anomalies, then inflammation, and lastly the tumor. And the congenital anomalies include absence of cervix, atresia of cervix, and biseptate cervix. And the inflammation include acute cervicitis, chronic cervicitis, and endocervical polyp. And lastly the tumor. The tumor, it may be benign or malignant tumor, and the benign tumor is commonly leiomyoma, and the malignant tumor are squamous cell carcinoma, adenocarcinoma, adenosquamous carcinoma. And there are also some pre-malignant lesion, that is cervical intraepithelial neoplasia. Then what is cervicitis? You know, inflammation of the cervix is called cervicitis. It may be acute or chronic. In case of acute cervicitis, there are presence of acute inflammatory cell, and in acute inflammatory cell the neutrophil is the most important acute inflammatory cell. Then there are presence of exudation, erosion, and reactive or reparative epithelial changes. These are the morphology of acute cervicitis. Then chronic cervicitis, there are presence of chronic inflammatory cell, that may be lymphocytes, macrophage, and plasma cell. Necrosis and the granulation tissue also may be seen. Besides, also there are presence of follicular cervicitis and Nabuthean cyst. When there is intense infiltration of lymphocytes and aggregation of lymphocytes to form a follicle, that is called follicular cervicitis. And in Nabuthean cyst, when there is cystic dilatation of endocervical glands due to blockage of crypts opening by hyperplastic squamous epithelium, it is called Nabuthean cyst. Now, what are the important organisms that are responsible for acute and chronic cervicitis? The clinical important organism causing acute and chronic cervicitis are gonococcal infection, mycoplasma infection, herpes simplex virus, and chlamydial infection. This picture showing a case of cervicitis, and this histological picture showing there are infiltration of chronic inflammatory cell in the lining epithelium of the cervix. And lastly, endocervical polyp. It is a non-neoplastic lesion, mostly inflammatory lesion, and this polyp arises within the endocervical canal. During gross examination, we will observe the polyp are small, sessile to large, and up to 5 centimeter mass that may be protrude through the cervical os, and they are soft and mucoid in nature. And in histological examination, they are composed of a loose fibromyxomatous stroma harboring dilated mucus secreting endocervical glands and often accompanied by inflammation and squamous metaplasia. What about the treatment? Simple curettage or surgical excision is the treatment, and this is the picture showing endocervical polyp. And that's all about today's session, my dear student. Inshallah, see you again in next class. Assalamu alaikum.